Hi, I'm Jacqueline Eckern, and today's vlog is about binge eating disorder. And binge eating disorder is fairly new on the playing field of eating disorders. It just in the last couple of years has been acknowledged as one of the key eating disorders, and that was done in the DSM-5. And the DSM-5 is important because it's entitled the Diagnostics and Statistics Manual of Mental Disorders. And the fifth edition came out couple of years ago where they finally said, hey, binge eating disorder is its own separate eating disorder and we need to address it. This is really important because so many people struggle with binge eating. In fact, more than with anorexia or bulimia, which we're all more familiar with when we think of eating disorders typically. So the question is, how do you determine if you have binge eating disorder? Well, the truth is that question should be left for a professional. So I would suggest if you have concerns about it, you do a little reading and you make an appointment with your physician, or if you have a therapist or a nutritionist, and talk to them about your eating behaviors and what's concerning you. And they can probably help you determine whether or not this would apply for you. And interestingly, there's a key 8 symptoms, if you will, of binge eating disorder. And if you have 3 or more of these behaviors with food on a consistent basis, definitely want to check it out with a professional who specializes in eating disorders or your physician and find out if this is something that you need to address. And those key factors to look for binge eating disorder are: do you eat until you're uncomfortably full? Do you have reoccurring binge eating disorder episodes where you binge on large amounts of food for a short period of time? When you're eating during these binges, do you eat faster than normal? Do you find yourself eating if you're not hungry? Do you have a tendency to isolate when you eat? Do you have feelings of shame or disgust about your eating behavior? And are you upset about it? Does this concern you and cause you some distress in your life? And then one of the other key factors is, in most cases with binge eating disorder, there is no purging or compensatory behavior for it. In other words, you're not doing any kind of massive purging or dieting effort in order to eradicate the calories that you consumed in the binge eating episode. So if any of these symptoms apply to you and you find that you have 3 or more, we really suggest that you talk with a professional. If you need resources to find an eating disorder professional, please check out Eating Disorder Hope. We have a national treatment directory where you can find treatment centers across the country. We also have a therapist nutritionist directory where you can find an individual practitioner to meet with. And then if you would like to educate yourself more on binge eating disorder, really encourage you to check out our blog and our pages on binge eating disorder. We cover a lot of material on this subject because it affects so many in our online community. And the good news is this is something that can be managed and treated, and there is much hope for you. So take that first step and check out with your physician, therapist, or nutritionist if this is something you're struggling with, and move forward in your life towards health and good choices. Thanks, and I hope this is helpful. Bye.